All right, in the spirit of time, we're going to go ahead and get started. So thank you to those of you that have joined us this morning. So far, I've got Roseanne Ainsa, Jenny Bartles, Morgan Finari, and Benita Lopez Baca, as well as Becky Diorio and myself on the line. This is Meredith too with Pelican. So what brings me to these DSMES sharing calls is that we have a contract with Centers for Medicare and Medicaid Services, and they have asked us to be a resource within our respective states to help address getting more people to diabetes self-management, since very few across the nation actually utilize these services. So that's our sole purpose in doing these calls, is to help you all increase access and figure out how we can get more folks into your program. And as you know, Inka is typically with me, but actually this morning we have her teammate Becky, which I know many of you also already know. But Becky, if you want to introduce yourself.
Yes, good morning everybody. My name is Becky Diorio. I'm the Diabetes Program Manager at CDPHE, and similar to Meredith, we actually have a grant from the CDC, and one of our goals is to increase utilization of DSMES. And then I'll just share a reminder of the purpose of the call. We know that there's a low prevalence of diabetes education among Coloradans who are affected by diabetes. So the primary purpose of these sharing calls is to partner with all of you to discuss barriers to DSME utilization, share success, and identify tools that may be helpful in increasing utilization throughout the state. The intended audience is ADA recognized or AAD accredited program staff, but you're welcome to stay on the call if you're not, but just know that the content is tailored to that audience.
Thank you, Becky. And just a few quick housekeeping items. If you wouldn't mind keeping yourself on mute to minimize the background noise, you can do that by pressing *6 on your phone, and then that also will unmute you if you have something to share. Please don't place your line on hold. When speaking, go ahead and state your name so we know who is sharing. And we'd like to encourage depth in sharing, so step up and step back. Also, we do have chat open for questions and comments. We try to keep an eye on that as we're going along. So if you have a question or something to share, feel free to use the chat function. And if we don't have time to address what comes through in chat, we'll follow up with that after the meeting. And then these meeting recordings are also made available. Many of you hopefully see that in the follow-up notes that we send out after the call. All right, so we changed this up a little bit this month. Typically, we've been having you choose your arrow and place your name on the map in Colorado. I'm going to mix it up and actually just have you type your name, organization, and city anywhere on the slide. So if you're with us on WebEx, if you hover over to the center left side of the screen, you'll see where you have a little squiggly mark. If you left-click on that, then a little bit further up on the screen, you see a text tool. Left-click on that. And then my color is default to yellow. You might want to choose a different color that will show up better. And then just hover your mouse and click anywhere on the screen and type away. It'll take just a minute for everyone to try that. Let me know if you have challenges with that.
Meredith, this is Roseanne. It's not working for me. I don't know why. The squiggly line is like grayed out.
Uh-oh.
This is Lisa. It's not working for me.
Shoot. Jennifer, do we have annotation turned on for participants? Well, I'm going to go ahead and type in. I heard Lisa Bentley, is that right?
Yes, that's right.
Good morning. We've got Roseanne. Are you all seeing information pop up on the slide as I'm typing?
No.
No.
Well,
And Meredith, this is Morgan, and I don't know why, but this is my third meeting where my WebEx isn't working. So just so you know.
Well, all right. The intent was there, but we're definitely not going to belabor this. We'll look into that a little bit more on our next meeting and move on to the next slide. But just to make sure I do have everyone captured, Roseanne, Jenny, Morgan, Danita, and Lisa. Is there anyone else on the call this morning? Okay, very good. Thank you all for joining us.
All right, so we have two main call objectives this morning. The first is to learn about the diabetes stakeholder meeting efforts in Colorado. And then the second is to understand how Colorado ADA and AABE program staff and DSMES sharing calls are informing the development of related measures and interventions.
All right. So this is something, let's see, looking at our list, Roseanne, obviously you'll be familiar with, but for the rest of you, I wanted to share about this morning because it definitely ties to the work that you are all doing together, and what you share with us is certainly informing this work. So we have convened a statewide diabetes stakeholder group, and when I say we, those that you see on the slide, and since we have a few of you that aren't on WebEx, I'll just share who that is. We're leading the statewide diabetes stakeholder group, so that leadership team involves me from Intelligence, Becky, and Inga from the State Department of Health, and also Christine Falabelle from the American Diabetes Association. And this slide just gives a visual representation of some of the other organizations that have been involved up to this point. That includes, well, really, Becky and Roseanne both have some representation with AABE. We've got ADA. We also have the Colorado Business Group on Health, Project Angel Heart, Denver Health, the Barbara Davis Center, the University of Colorado Denver, Encena Health, HRSA Region 8, JDRF, the Colorado Community Health Network, Colorado Rural Health Center, and Metro Caring. They've all been at this statewide diabetes stakeholder effort that we've been convening. So really, if we think about the purpose of that group, what we did early on was a consensus building activity where we asked all of those at the table what they would have an interest in working on together as a state. These 5 areas shown on the slide are what came forward. So the first area is DSME and DPP sustainability and advocacy. The other 4 areas are different models of diabetes care, education, and this education is in regards to education going out to others, say physicians or community, versus diabetes education given to patients. The 4th area is food security and social determinants of health, and then the 5th being outreach. So that's a lot of information, and we obviously, to take action in all 5 of those areas, is a lot of work. So the one that rose to the top, and when I say rose to the top, the most people that had the most interest was in that first area of DSME and DPP, sustainability and advocacy opportunities. So the information that we hear on these calls with you all who are in the program for DSMES or interested in starting programs certainly inform those efforts. I'm going to toggle over to what we're referring to as the organizing statement of this group. And this essentially just walks through letting people know what we're up to. And so I talked about who we're organizing in this group. Secondly, what do we hope to affect? What do we want to measure? And then it also goes into how we're going to do that, what are the tactics, what is our motivating vision, and by when do we want to do that. So we're currently in the process of looking at all of this. So I'm going to spend just a minute specifically in this area right here, which is the measurable aim and what this group would hope to accomplish. So we sent out a survey monkey and asked them to vote on what their priority measures would be, and that weighted those. So you can see, if you're looking at the slide, the top two that rose to the top, number one is to increase coverage of DPP and diabetes self-management education services. The second is to increase the number of DPP and diabetes self-management sites in Colorado. And there are a bunch of other measures listed. For the sake of time, I'm not going to name all of those. But that is essentially how we're prioritizing the statewide work. Let me toggle back over here. So keep all of that information in mind. And then I'm going to have Becky talk a little bit also about the state engagement meeting. And then we're going to come back and have some discussions with you all and how you might see yourself involved in that work.
Great, thanks, Meredith. So I'm just briefly going to share a little information about the state engagement model, also called STEM. Colorado was informed by our CDC project officer that we will be the recipients of a state engagement meeting this year. The STEM meeting is a collaborative effort by the National Association of Chronic Disease Directors and the CDC. And Colorado had one of these meetings. It was called something different, but essentially a state engagement meeting way back in 2012 that resulted in the development of a 5-year diabetes prevention action plan. So CDC and NACDD felt that Colorado was in a good position to have a follow-up meeting, also known as STEM 2.0 is what we're calling it for short. So we're the first state in the country to have this opportunity to have this meeting come back to our state. So this will take place later this year, late summer. And the focus has historically been on the National Diabetes Prevention Program and diabetes prevention efforts. But we've told CDC and NACDD that we'd like to also weave in DSMES. We've been focusing on both of those through these diabetes stakeholder meetings, and it's important that this process includes both. So the STEM model really is a 3-phase approach. There's a 6+ month planning phase, which we're in right now. Then there's an implementation phase, and that includes a 2-day meeting in person in Colorado. So NACDD, CDC staff, everybody flies into Colorado. It's a big 2-day meeting. The first day is a large kind of call to action educational session day, and then the second day is an action planning day that will result in the development of a 2-year, so a shorter term, action plan. Then NACDD will provide ongoing support through the post-STEM phase as we work to implement the plan in our state. So we're really excited about the opportunity. Again, no other state in the country has had the opportunity for a follow-up meeting, so we're a bit of a guinea pig, and it's exciting, and all of the work that has been done, both on these calls as well as in the diabetes stakeholder group, has really led nicely into the culmination of this 2-day meeting later this year.
Thank you, Becky. So just putting all of that to a visual that you'll see in this slide, really, as Becky mentioned, the combined efforts of all of these things are really coming together nicely from a timing and objective perspective, because ultimately all are working to the same end, which is really in regards to, again, being able to increase statewide diabetes prevention and self-management access and utilization. Okay, so here's where we're going to start hearing from you on the call for our polling question. Becky?
Great. So I'll read the question before we open the poll, and as well as the answers. So which one of these measures do you think your organization could most directly impact? So measure 1, increase participation in diabetes self-management education programs. Number 2, decrease diabetes-related emergency and inpatient utilization rates. Number 3, maintain or decrease the prevalence of adults with diabetes. Number 4, decrease Colorado avoidable healthcare costs related to diabetes. Number 5, increase and align payments tied to diabetes prevention and self-management measures. Number 6, increase consumer satisfaction rates for diabetes self-management education. Or 7, not applicable. Again, the question is, which of these measures do you think your organization could most directly impact?
I've opened the poll, if you all wouldn't mind taking a second to answer that if you're with us on WebEx. And we know there are a lot of options there. For those of you that are with us by phone only, if you have any thoughts to share on that, please feel free to take yourself off mute and let us know your thoughts.
This is Jenny. I think one of the options that you mentioned was preventing or kind of working with ER visits related to diabetes. And I think our organization has, a great opportunity to really work with this. We have a care coordination team that we partner with, and so we're developing a relationship with them so we can identify patients who have been in the ER due to diabetes and do some outreach and education with them. And so as part of our organization, we're looking at requests for medication refills, and a lot of the requests are actually diabetes related. And we have a nursing desktop that where we've identified this is an issue, and sometimes it is just because patients maybe don't have refills on their medication. So I feel like that's that issue, and then the first one that I think was increasing access to the program.
That's great. Thank you, Jenny, for sharing.
This is Benita. Oh, sorry. Go ahead, Benita.
I'm with Nova Nordisk, and our education program is really to support clinics and practices that need clinical staff to be more educated so they can provide their providers with some support when they are initiating injectable therapy. We're discovering that primary care is not feeling comfortable optimizing therapy for patients. Sometimes there's just clinical inertia because it gets to be complicated. So one of the things that we're trying to work with, especially with UC Health, because UC Health is just really expanding and acquiring a lot of these clinics, and they're looking at population health management. And so we're trying to go in and trying to see what their needs are from an educational perspective, so then that the office can provide some education in the office to support when the provider has to start a patient on injectable therapy. We're finding that it takes longer for them to optimize therapy for some of these patients. And so that's one of the focuses that we have, that we're working with coming through our education program through Nova Nordisk.
Great. Thank you, Benita. And then Morgan, I think you wanted to share something.
Over here at SCL Good Samaritan in Lafayette, we are partnering with one of the local SCL physician groups and applied for a $50,000 grant to work on some patients that are coming through their office and other SCL offices that may not be having good diabetes care or coverage. And through the grant, we're hoping that we get awarded it so we can put together diabetes programs to help the grant cover them so people can go through them so there's no cost to them. And for like supplies, MNT, diabetes education, and this way we can support our community a little bit better because we're finding it's hard to retain people because there's such high deductibles and big out-of-pocket costs. So.
Well, how exciting to hear the great work that you all are using. And if we tie that back, you can certainly see how some of the measures that we've brought forth and the efforts that you've mentioned could, for example, contribute directly to decreasing emergency and inpatient utilization rates or decreasing Colorado avoidable health care costs. So a great example just through what you've shared, again, how your efforts are directly helping inform these statewide efforts. And as far as those of you that took the polling question on the screen, you have some varied results. So that's good to see. All right. So in the few minutes that we have left in the facilitated sharing for the day, again, thinking about the really brief high-level overview that Becky and I have given on the statewide diabetes stakeholder effort and the upcoming STEM meeting, we'd like to hear from all of you. Number one, is this something that you feel your organization would be in support of you participating in some way? And if so, how do you see yourself participating? If not, what might be your barriers? So really thinking about your day-to-day role and the work that you do within your program and how it relates to these statewide efforts. So again, number one, how you feel about your organization's level of support, and number two, some specific thoughts on how you might see yourself contributing. And just know there's no right or wrong answer for this. So I'm just going to open up the floor to all of you. And Becky, if you have anything to share or kind of prompt conversation, please chime in.
This is Roseanne. I know that AADE would support me being involved in this. Whether or not my employer would support me, I don't know, but I have plenty of PTO so that I could take time off to do it. And then as far as individual, I'm not sure I understand exactly what that question means.
Thanks, Roseanne. So, examples might be of individual level support. So again, if your organization is in support, do you see yourself maybe participating in a work group or helping to share information about the efforts, helping develop materials, those types of things.
This is Roseanne. I could see myself helping in any of those areas.
Great.
And this is Benita, and I definitely would like to get permission from my company as well, but I could see myself contributing in many of those areas as well.
Thanks, Benita.
This is Morgan. I mean, I definitely would like to contribute to those things. I just don't know how much my organization will support that time.
Yeah, and we certainly understand that barrier. Obviously, a lot of you are dealing with direct billable time, so that's something that we're trying to be cognizant of.
This is Jenny Bartles, and I'd be very interested in participating. I do think my organization would be supportive of it, and more of my perspective would be more from an FQHC perspective, how to work with patients who maybe are underinsured, uninsured, and some of the barriers that they experience with diabetes care.
Thank you, Jenny.
This is Lisa. I kind of agree with Jenny on that. I think our organization as a whole and just the community surrounding had a meeting about just providing more diabetes care for the uninsured. So I think as a whole they would be supportive. I'm not sure how that would look like on within our department or on an individual basis as far as time and things like that go. But yeah, I think we'd be interested as a whole.
And Lisa? Becky, are there any specific questions that you have that you want to bring forward to the group?
Not that I can think of. I think that was helpful. I guess one follow-up I'd have, I know we don't have a ton of time, would be if you may not be able to spend a lot of time, just like with your employment situation, how would you best like to be informed of these efforts at the state level? Like what process of sharing that information back to you is helpful?
Is the current mode of communication that we're using, is that working for you? And in this situation, if we were to add in information about the statewide diabetes and STEM efforts, do you feel like that would be a good way for you to continue to receive that information?
Yes, for me, Benita.
All right. Well, if you have any other thoughts on that, certainly you know how to find Inka, Becky, and I. You can feel free to give us a call or email that information as well. So thank you for sharing your... Yeah, go ahead, Roseanne.
I just wondered if there had been any finalization as far as the dates.
Not yet. Yeah, sorry, not yet. We're still looking for a venue, so we don't have those dates yet. Sorry.
Okay, thank you.
All right. So as usual, our calls always go pretty quick, but thank you for sharing. Thinking about the next step for these calls, the next will be March 20th, and we're wanting to turn the spotlight on you. We've already talked to a few of you and maybe reaching out. I really want to be able to highlight some of the best practices and successes that you all are seeing within your own respective programs. So that's what we'll have on the agenda for March and moving forward. We always like to keep our related resources. So Becky, who is here with us on the call today, our contact information is here. in regards to diabetes prevention efforts. Just a reminder that we do still have free one-on-one technical assistance calls available through Telegen and our national contracts with Marianne Todorowicz, who is a national expert in DSMES and MMP. Many of you have taken advantage of that, and we're certainly happy to offer that to any of you who haven't had that opportunity. And then added some new resources with associated links. The CDT link to DSMES information, the CDC DSMES toolkit, and then at the bottom, Telegen has some diabetes, prediabetes, and cardiovascular resources available. So feel free to check all of those out. And we're going to open up just a quick 3-question evaluation on the meeting so we can continue to best serve you. If you wouldn't mind taking that quickly before you leave, and feel free to reach out to us in the meantime. Otherwise, we hope to speak to you next month in March. Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thanks.